talk about how to price check your medical bills like a pro. I talk about this all the time. It comes down to CPT codes. CPT codes are to medical services what barcodes are to products in a retail store. So let's say that fortunately, you have to go to the emergency room. They put an IV in and they give you fluids. You're all set to go. You're going to get a CPT code for that service that is different than if you, God forbid, fell and broke something. I really want you to focus on memorizing that there's a different level for each service of care that you receive. So in the emergency room, a CPT code describes level 1 through 5. In our example, if you're just dehydrated, that's a level 1 or 2. If you go in and you have a serious break, a serious injury, that is a level 3 or 4. That's why it's really important that you find your CPT codes for the services you receive. And I was calling the outpatient department for a hospital where a patient or a client asked me to go over their bill. So this particular outpatient department was primary care, and they're part of a large hospital system. So this is their outpatient department, but they still bill as a hospital. When I called to talk to the billing department, I said, this client is disputing this bill because he says that the CPT codes don't describe the level of service that he asked for which he made the appointment, and that he received. And the customer service rep for the billing department said, well, how did he get that? How did he get the CPT codes? Now, in my head, I said, well, that's interesting. Why is that a problem? That is his right. That's how he knows what to pay for accurately and not get overcharged. Out loud, I said, well, because I told him to ask for them. So that is the first step in price checking your medical bills like a pro. Call and ask for a real bill or statement or something with CPT codes. And I talk about the 3 steps of the only right way to pay any medical bill. And that's what we're talking about. We're talking about where the money is. That's the CPT codes. And it's interesting, in this case, you get pushback is not unusual. Unfortunately, the hospital and any large provider will say, what do you mean CPT codes? They're going to often play dumb, or they really don't know what you're talking about. That's because that's where the money is. If you have to ask why, follow the money. I just find it very sad that we're having to have these conversations that's what you have to ask for, and that it's not automatically sent to patients. If you have insurance, the bills that get sent from your provider to the insurance company, they all have CPT codes. Why? Because the insurance company is saying, how are we supposed to know what to pay? We pay certain amounts for certain things. I just find it very interesting that, unfortunately, many large providers and sometimes even ambulance services will not be forthcoming and keep the CPT codes away from patients. The 5-digit codes that are going to tell you what the services you received are and tells you, hey, this is how I find what a fair price is. All right. So price checking your medical services that you received either a UB04 form or you received a real bill with CPT codes. The next thing you need to do is to price check against a fair price or a fair charge for the services you received. And where do you find that? That's already been done for you in terms of Medicare. The federal government has determined and negotiated for you the fair price for services that medical providers charge for your care. You don't have to have Medicare. You don't have to be old. And the provider doesn't have to accept Medicare for you to not be overcharged. So you're going to take each CPT code and find out what Medicare pays for each of those services. I used to say do a Google search or an online search, but you know what? It's faster now. We live in the 21st century and the AI age. Just do an AI search. And if you go to medicalbillrelief.com, actually, we've done that for you. You just upload your bill and up will pop the fair rate for the medical services that you received. That's how you price check like a pro. So I talk about these and how to do them in 3 simple steps. Step 1 is to call and ask for a real bill. If you get a bill in the mail that doesn't have the CPT codes, sometimes it'll say CPT/, HCPCS, HCPCS. This is a subtype of CPT code. So each one of those, you're going to go to step 2 and price check. That's where you're going to find AI search, medicalbillrelief.com uploaded, and find what Medicare pays for each of those services. And that's the lowest price that any provider in the United States would accept. Now, a lot of people who do this work say because the numbers are so low, what Medicare pays for services, they double it. They suggest that you double the price that Medicare pays for the services that you received. Okay, so what we've done is in medicalbillrelief.com, we said, you know what, we're automatically going to double the Medicare rate. So it really is a fair rate to determine, hey, this is what I should be paying. Then you can go back, step 3, call the billing department back and say, in my case, I've done research and I'm not able to pay this. This is out of my price range. Who can I speak with? Who can help me make a payment plan that is within my budget? So that's how you price check your medical bills like a pro. You can get more support at medicalbillrelief.com.